I'm Dr. Manjot, and I'm an MD dermatologist. And I am currently practicing in Himachal, in Hamirpur, in Dharamshala in Himachal, and I have two clinics in Punjab, one in Jalandhar and one in Mohali. I am a board certified dermatologist, and you can reach out to me for any queries that you feel during this live, or if you wish to connect again with me through my Instagram account, and we can guide you further depending on whichever clinic is nearest to you. So, my Instagram ID is dr.manjot, Manjot underscore MD. So today's topic that I am going to be discussing further is on dry skin in children, and this is a very common problem. So nearly 1 out of 5 small kids, like less than 1 year old infants, suffer from dry skin, and they're usually parents tend to apply a lot of ghar ke nuske. So they are ghar ke jo choti badi cheezein that the neighbor told them, or some dai has commented that try this, and people end up trying a lot of things, and the kids eczema usually gets worsened with this by the time they reach to us. So, the purpose of this live is that I guide you on what type of moisturizers you should use, and how you should stay away from using any homemade remedies for kids, because they don't have a proper skin barrier. Their skin is not as good functioning as an adult skin. So you need to protect them. You need to moisturize it a lot. You need to layer moisturizers. This is very important. You need to check for moisturizers which have ceramide in them, which have good occlusive properties in them. And just doing an oil massage is not very helpful. So using different types of moisturizations, you layering them, and protecting your child from unnecessary chemicals is very important. Another common question that comes out is what we can do to avoid such dry skin and allergies. So firstly, you need to know that dry skin that the child is getting may actually not just be simple dry skin. It may be an eczema, and eczema, which is very common, known as atopic dermatitis. So when we talk of atopic dermatitis, it is extremely irritating. It has very itchy skin, and the minute the moisturization factor of the skin drops, this child starts itching again and again. So if you are, or if your child is suffering from this type of eczema, there are some particular signs that we see in it, and you do need to consult a dermatologist if it is not in control by just a moisturizer. It is better you start treating the child early. It's very common, and you do not need to get worried if your child suffers from this. So this is a few introduction that I can give you to dryness in kids. And if you have any queries, you can leave them in the comments, and I will be happy to help you out. So few other things that while we're getting the questions that I like to expand on is the fact that a lot of parents ask that why my child, why not why did my child have it, did I do something wrong that my child is suffering from atopic eczema or dry skin. Now, this is a very difficult answer to give why your child has it, but there are certain hypotheses in this. If a child is exposed to allergens early in life, by allergens, I mean that, if you take your child out, if you expose them to like different dairy products, or expose them to dust, expose them to different, suppose you have dogs in the house, and since birth they are in exposure to the dogs, there's a less tendency that your child is going to be allergic to animal fur. But if the child has never been in exposure to animals, there's a higher tendency that later in life they may have such allergies. Okay, so there's a question that came in is, how should I take care of my baby skin during the monsoons, especially the diaper rashes? Now, diaper rashes is something in the first 3 months, especially even during teething time when the diarrhea comes in, and it's very troublesome, and the kids are very irritated with it, and the mothers usually ends up trying everything possible. So, What you can do instead of that is, firstly, try to give diaper free time in the morning and in the evening, especially before the shower or something. You can keep them diaper free for some time. That helps. You can try using, maybe not using a diaper throughout. You can use a cloth diaper. If you are okay with cloth diapers, they're the best thing. If not, then what you can do is you can use a cloth diaper and a normal diaper, alternate between them. So that would also give some diaper free time to the child. You can also use barrier creams. Now, barrier creams are what are the diaper rash creams, and they're easily available in different brands. I am not very fond of using talcum for the kids, but a barrier or a diaper rash cream is much more effective. And if it's still not in control, you need to show a dermatologist. There may be a fungal component in it, and that may get better once it's treated by a dermatologist. So these are few tips that you can try for the diaper rashes. Okay, but rest assured, do not panic when it happens. Don't get too worried about it. It does go. It's something that every mom faces. So you're not alone. Okay, the next question is, what about children with acne? What over the counter remedies do you suggest? So, normally, when we talk about children with acne, we either it is neonatal acne. If you're talking of a baby that is just born, then do not treat it, it will go on its own. If you are talking about children 12, 13, 14-year old, so this is teenage acne, and what happens is, what you can do best for this is use a salicylic acid based face wash. A salicylic acid based face wash will help in giving some oil control regulation to them. And you can use salicylic acid based serums also. You can also use clindamycin gel, which would be helpful, and the clindamycin gel can be applied on the acne. So that is something that's safe to use. But I think mostly the face washes work very well. Okay, my so the next question is, my newborn has really dry skin. What causes this, and what can I do? So if your newborn has got really dry skin, there could be many factors why he's getting it. It could be because of maybe genetics also. Maybe you have a tendency to dry skin, that's why. Also, if the mother has thyroid issues, or even then they can be there. Another issue that comes with this, if you're not using the right products for your child, that is another reason where you can get dry skin in kids. What you can do for them is choosing the right moisturizer. If you use the right moisturizer, it can go a long way. I have already mentioned certain ingredients that you should look in your moisturizer, and also the cleanser. The cleanser should be very gentle. You should look at the pH of the soap or cleanser that is written when you buy a cleaning product for your child. It's very important that the pH is 5.5 or lower. This goes a long way in maintaining the skin. So do look at that aspect also. When you thinking of moisturizing the child, few creams that I would like to there are a lot of good baby creams, like Cetaphil has good baby creams. I think Baby Chakra also came up with their own range right now for baby creams. And there is Aveeno that is there, which also has very good moisturizers. The Sanosin, these are few brands which are very good creams for babies. One home remedy which works well for kids is an oatmeal bath. So you can take grinded up oats and put them in the tub or the bucket. Give the child the bath with that, and after that, let it be on, like let the wet skin be there for a while. You can make them wear wet clothing and then dry clothing, especially if it's summer. This is something that works. Two layer of clothing, once wet and then dry. So this makes the child a little extra hydrated, and it works in a very natural way in protecting the skin barrier. So that is one way of doing it. Okay. So another question is that, are children more apt to being allergic to mosquito bites? So um are children more prone? I think that's what you mean. So mosquito bites and children were very very close connection that is there, because what happens is, it's not necessary that when you see your child with say 5 or 6 mosquito bites, that these 5 or 6 mosquito bites bit them. what actually happens is that your child is allergic to the bite. So what happens in this case is that even if he gets one bite, the bites that he had in the next, like past 4 or 5 days, everything gets active. So he ends up getting 5 to 6 boils instead of having one boil. So it's more of an allergic reaction to the mosquito bites rather than just the bite. Please use mosquito repellent patches and creams, which go a long way. Once he's got a bite, then plain calamine lotion is the most effective thing that you can do. You can apply ice also, that also works very well for it. Okay. So, and Baby Chakra has mosquito patches. I'm getting a message on that also. So you can try their mosquito patches also, and they work very well, especially for kids with eczema. That is something that's a must, because kids with eczema or allergic tendencies are usually allergic to everything, even their clothing material that is there. That's also very important. What material is being used? So you need to, keep them away from allergens if they have developed the allergies. If your child is right now not allergic to anything, and if you've got a newborn, then you can introduce them to allergens so that later in life they don't develop these allergies. So if you've just delivered and you have a newborn baby, start introducing the child to maybe uh, like I said, like taking them closer to the pets, introducing them to maybe milk products earlier in life at 6 months itself, and introducing them to, even at 6 months, when you introduce them to food, if there's no history of any nuts in the family, you can give a nut powder to them in their food. All this goes a long way in preventing them from allergies. So I personally am a mother to an infant, and I have made sure that I take my child out, and even since, like, he's been a month old also, and I made sure that he wore woolen clothes, and I introduced, used those fur blankets initially when he's not allergic, so that he gets used to this, he gets used to the environmental factors. And this actually has helped a lot, and it helps in building the child's immunity also. Another thing that you can do if your child is having a lot of eczema is giving them probiotics. There are special probiotics which help in the gut modulation, and the gut flora gets better. By gut, I mean the tummy, the bacteria that are going to be in the tummy of the child, and they help in giving protective immunity to the child against these allergens. So that is also another way in which you can help and reduce eczemas in babies. So yes. Okay, I'm getting lots of comments that this is helpful information. Thank you so much. If you have any queries, I'll be happy to take them, or else y'all can reach out to me later, even after this live. Another question is on the dark circles that sometimes kids get. So sometimes when there is too much allergies, what happens is the kids end up getting, they tend to rub their eye a lot, and because of this rubbing they get this dark circle around the eye. It doesn't need special treatment, it doesn't need different treatments. They are not dark circles. If you just use a good moisturizer even around the eyes and reduce their allergen exposure, it makes a lot of difference. That itself will help in reducing that dark circle. So that's another factor. So my daughter has small ring-like dry patches on her body. They don't itch, but they look terrible. What should they be? So if they're not itching, okay, and there are different types of ring-like patches. It's difficult for me to diagnose them. If it's very, like pokey, and it's very rough in feel, then you don't need to do anything. That is lichen spinulosa, and you don't need to do anything. They do go on their own. There are medicines for it, but I would suggest just let it go on its own. It's okay. If the patches are maybe white in color, then you need to maybe use a little anti-inflammatory cream on it, and it's best if you show a dermatologist and then use it, because it's a child. You don't want to end up using what you're using for yourself on the child. There are different strength creams which we use for a child, which are much more safer. So if it's not itching, and if it's just the looks, then do visit a dermatologist. I don't think it's very urgent, but do pay a trip whenever you have the time. Another question is, my child is diabetic. Any skin issues I should be aware of now or later in life? So, if you have a diabetic child, you need to be sure of the infections. So, because they will tend to get more infections. So, even if your child ends up getting a small scratch in school, do not ignore it. You need to apply an antibiotic cream on it. And if your child is into sports, be careful that the sweating and everything is you are maintaining good hygiene, because you don't want any fungal infections in your child. So just that, even small wounds and small infections, they need to be treated fast. You cannot leave them just to nature. You need to be aware that it takes time for diabetics to heal, if they catch infections faster. So that's one tip that I would give. And also they generally have very dry skin, so you do need to moisturize also. So I think I've answered all the queries that were there and raised by the people who have come for the live. Firstly, thank you so much for joining the live, and I hope this was helpful to everyone. And hopefully we can connect again. Thank you so much, Baby Chakra, for giving me this opportunity. And thanks.